Hello and a very warm welcome to all of you on our 4th episode of the Living Room Conclave India Health Mission series. Now, data from the National Library of Medicine reveals that breast cancer is the most common malignancy among women globally. Now, from being 4th in the list of the most common cancers in India during the 1990s, it has now become the first. Reportedly, the survival rate of patients with breast cancer is poor in India as compared to Western countries due to the earlier age at onset, late stage of disease at presentation, delayed initiation of definitive management, and inadequate and fragmented treatment. Another factor is the efficacy of the screening test in avoiding the risk of false positives and unnecessary biopsies and surgeries. Understanding India's specific differences by utilizing genomics may enable the identification of women at high risk of developing cancer, where targeted screening may be cost-effective. There is an urgent need to identify Indian-specific genetic biomarkers. In an effort to inform, educate and guide Indians against the threat of this serious disease, Times Network, along with a panel of experts today, will highlight and discuss breast cancer, its impact and effective treatment to combat this growing menace in India. Allow me to introduce my guests, my experts. We have Dr. Qazi Ahmed, consultant plastic surgeon at Kokilaben Ambani Hospital. We have Dr. Seema Gulia, she's the Professor, Department of Medical Oncology at Tata Memorial Center. And we have with us Dr. Mandar Nadkarni, he's the Head Breast Oncology at Kokilaben Ambani Hospital. Thank you so much, doctors, for joining me here today. Dr. Nadkarni, first question to you. Starting from the basics, breast cancer, yes, it's worrisome. We have some stats that it's quite prevalent in India. And reportedly, young women, almost as much as 22 years, are also acquiring breast cancer. So what's your advice to women? Is there something in the lifestyle that they can do so that it worsens the chance of getting breast cancer? How can they kind of protect themselves?
Out of 100,000, that's 1 lakh women in the country, the incidence of breast cancer is only 28.5 in our country. Compare that to close to 100 in, say, the United States of America. So yes, our numbers are slowly going up, but we are not as many as maybe the Western world. The lifetime risk of developing a breast cancer, all over the country is about 1 out of 25.4 women as per the latest data. In the urban areas, it's 1 out of 22 women. In the rural areas, it's 1 out of 34 women. This disease, the most common age group is between 40 to 50 years of age. So yes, we do see women, like you said, the young who are younger, say 20, 22, and the youngest woman that I have treated for breast cancer is 17. But please let me tell you that these are anecdotal. Younger women really do not get this kind of disease. This disease generally in our country is seen to be more prevalent between 40 to 50, 55. That's primarily because our age, our epidemiological numbers of women in that age group is very high. Statistically, if you look at it, the risk of cancer, of developing breast cancer goes up only after you cross 50 years of age.
Okay, so people should not be worried, be aware.
Aware, but not...
Don't panic.
Correct.
That's the important part.
Correct.
Ma'am, Dr. Seema, I'll come to you. So, one important part about detection of breast cancer is checking for lumps in the breast. But what are the other risk factors and early detection signs and symptoms that women should be aware of?
So, the most common signs and symptoms which gives us an idea that patient is having probably a breast cancer is like a lump in the breast, any change in shape or size of the breast, any inversion of the nipple, that is nipple is turned inside, any cracking over the skin, there might be a pitting over the skin like an orange peel. So these are the most common signs and symptoms, and in early stage these lumps are painless. So what we see in our clinical practice that most of the patients present to us in late stage. And why they present late? Because they feel that there is a lump but there is no pain, so there is nothing to worry about. So I would like to highlight here today that any lump in the breast, please get yourself checked.
Important.
Yeah, that is the most important message.
And doctor, when should be like a regular checkup? Every 6 months, every 1 year? When should women be getting this check done with a doctor? I mean, coming to a doctor.
Yeah, so there is, no definite guidelines that they have to do it every 6 months or once a year. So there are guidelines for mammography, and as Dr. Nadkarni has alluded earlier, that the incidence of breast cancer is much higher in the United States compared to India. So those guidelines which are there for Western world, they do not apply to our country.
That's most important.
So what we did in Tata Hospital, there was a study where the clinical breast examination was done, and then we have found that only with the use of clinical breast examination, more and more women were diagnosed with breast cancer at an early stage, and it has found that the risk of dying from breast cancer was also reduced. So what I would urge all women that they should know their breast themselves. They should be aware of their own breast. They can do clinical breast examination, and if they feel something is different, which is different from the routine, they should get themselves checked.
Dr. Ahmed, I'll come to you next. I want to talk to you about lymphedema. What role does that play in for a breast cancer survivor's quality of life? So if they've, unfortunately, someone's faced with breast cancer, what can be done? And in your advice to even healthcare professionals about lymphedema, what would your thoughts be?
See, lymphedema is because of the node dissection that happens as part of the cancer surgery for the breast. So lymphedema, because there is a blockage of lymph flow because of the nodes are removed, it happens few years after the breast cancer surgery. So proportionate to the amount of node dissected, you are in the risk group of developing lymphedema. So you should be a little careful about avoiding some injury to that arm where the surgery has, that side has happened. Don't go for waxing, avoid burn and avoid tattooing that area. Take care of that arm, keep it massaged and all that. If you feel that that is developing, then you should wear some pressure garment. So pressure garment is important in the early part of the lymphedema management.
Coming back to you, Dr. Nadkarni, so there are a lot of words that come out for a layman, which for the medical fraternity, of course, you all are aware of this, but for layman, we get confused. So, like lumpectomy, mastectomy, what is the difference between them for the treatment of breast cancer, and what stage do patients need this?
Like the name suggests, mastectomy, it means removal of the whole breast. And for a long time, the world, it was a great treatment. It also is a good treatment today. But for a long time, the world believed that the only treatment for women with breast cancer was a mastectomy. Till in the 1960s and 70s, some clinical studies were done where surgeons did some studies to see whether only taking the lump out without taking the breast out with a margin and then addressing lymph nodes in the armpit by doing a sentinel lymph node biopsy followed by giving radiation to the breast would be as good as doing a mastectomy. So the lady would get to keep her cure rate, at the same time get her breast saved. And many years of data, mature data, more than 25 years of data today says very clearly that you can do a lumpectomy with a sentinel lymph node biopsy, give radiation to the breast and give the lady the same cure rate without her needing to sacrifice the breast. But it comes with a rider that this lady should have localized disease in one small area of the breast, either one tumor or two tumors in there. If unfortunately she has multiple tumors, then you have no option but to do a mastectomy, and this is where we do a reconstructive surgery for our patients.
Dr. Guli, I'll come to you. On another point people talk about is chemotherapy as a way to help increase the chance of a cure, decrease the risk of cancer returning. So is chemotherapy mandatory for all patients? How are you able to guide patients about chemotherapy? Okay.
All patient doesn't require chemotherapy. So there are different kinds of systemic therapy like chemotherapy, hormone therapy or the targeted therapy. Depending upon what type of breast cancer a patient is having, the kind of systemic therapy is being planned for an individual patient.
Okay, so again that's important because very often not just women but people are also, when you say cancer, they immediately think about chemotherapy and they get worried about that also, about some side effects, etc. So it's good to know that case by case, obviously the doctor is the right person who understands what your what the kind of cancer is, what is the level of the cancer, and therefore the right way of treatment. Dr. Nadkarni, one other point again is the word biopsy that comes out. So again, is biopsy, is it mandatory for the diagnosis of breast cancer? Does it cause the disease to spread? Again, because there are a lot of myths around biopsy. So we'd love if you could help clear some of these myths.
The only proof of a disease being cancer is not a clinical examination. It's not an imaging, a mammo or an MR or anything. It is a biopsy, and it is mandatory. There are two types of biopsies. One is a fine needle biopsy and the second one is a core needle biopsy. The purpose of doing a core needle biopsy is to find what kind of disease you have and to try and find the estrogen receptor, progesterone receptor and HER2 receptor status. In other words, what are the drivers of the disease, because this in turn decides how you are going to treat the patient in the future. Whether you're going to do surgery first, whether you're going to give chemotherapy, targeted therapy first and do a surgery later, depending of course on the stage of the disease. So yes, biopsy is mandatory. And the big myth that a biopsy causes the disease to spread, I think needs to be broken. Nothing like that happens. A biopsy is safe and needs to be done.
Very important point you made, doctor, because that's the exact thing. People get worried about biopsy, that okay, it's the end of the world. And I mean, I don't know, they connect it to so many things. So it's good to clarify these doubts. And actually now coming to Dr. Gulia and Dr. Ahmed, because before we continue our conversation, just on this point of myths, any other myths that come to you, both of you, whoever would like to address this question?
One myth is that reconstruction is a cosmetic surgery. People see it is an additional thing, superfluous thing, it is cosmetic in nature. It is not a cosmetic surgery. When we are talking about breast reconstruction, it is a reconstructive plastic surgery. It's not a cosmetic surgery. It's meant to restore the body image of the patient, of the lady. And that is the reason that most of the insurance companies, they cover the surgery. None of the cosmetic surgery is covered by any insurance company across the world.
Dr. Nadkarni, genomic assays or DNA sequencing, that also helps in predicting the way breast cancer grows. So how does that work, and which treatments might work best for that?
So genomic assays really in breast cancer have been very widely investigated and have been put in use in early breast cancer in hormone receptor positive or the estrogen and the progesterone receptor positive breast cancer patients. In this group of hormone receptor positive patients, in early stages of the disease and not in advanced stages of the disease, we have genomic assays. Genomic assays do not look at the morphological characteristics of the tumor, but they look at the genomics or the genetics of the tumor and look at the presence or the absence of bad genes within the tumor that could spell a risk of recurrence in the future because of the ability of this disease to grow rapidly. When you do this assay, you end up getting a sort of a recurrence score. And there is a guideline that tells you that if it is below a certain recurrence score, this patient is not really going to benefit by giving chemotherapy, and patient can just take hormone therapy, which is a tablet to block the hormones within the lady's body, and she's going to get the same cure as she would have got had she taken chemotherapy. So no added benefit of chemotherapy. But latest study that has come out from one assay shows that in early hormone receptor positive breast cancers, you can avoid chemotherapy by using these assays in as many as 5 out of every 6 patients. So once upon a time, we were probably over treating this small group of patients, and today by using these assays, we can unnecessarily avoid the anxiety, the side effects, the cost implications of chemotherapy and give them the same cure rate and a better quality of life.
Ma'am, I'll come to you. So, Dr. Gulia, there is one thing that Dr. Nadkarni said, the reoccurrence. That's a big concern for women, obviously. So, what is your, what should women keep in mind about reoccurrence? How should they be keeping things in mind after, if God forbid, they've been diagnosed once? How do they, prevent reoccurrence? Is it preventable, or is this just to take more care, be aware?
So the risk of recurrence depends upon at what stage patient was presented to us. Initial stage at presentation, the tumor size, whether axillary nodes were involved or not, all these factors will help us to estimate what is the risk of an recurrence in an individual patient. But once the treatment is done, the patient should be on regular follow-up. We advise clinical breast examination or clinical evaluation every 6 monthly and mammographic evaluation once in 18 months to 2 years.
Okay.
So they should be regular on their follow-up. Because even if recurrence happens, sometimes the recurrence is localized. That means it is limited to one area where they can still be treated with a curative intent. So even if the recurrence happens, or even if patient present to us in advanced stage I mean when the disease has spread from breast to other parts of the body, which we label it as stage 4 disease. These patients can still be treated, and they have the disease can be kept under control for years together. And depending upon what type of breast cancer individual patient is having, the disease can be kept under control as long as 4 to 5 years.
Okay.
Maybe more than that.
So there is
a hope.
Yes, there should not be, again, no need for panic, no need for worry, just go to the right doctor, consult, and there is a way out. It should not be the end of the world, like we said. Women, and if these are women who've got this at 40, 50 years of age, they have a family around them, and they are the pillar of that family around which the family revolves. So the full family gets impacted. So in your experience, how do you guide these patients?
So people who have undergone reconstruction, they have larger interest in life, they have larger interest in themselves, and the cancer is a long-term treatment like surgery, radiation, chemotherapy. So this subgroup of people who have undergone reconstruction, they have their enthusiasm to complete the whole range of treatment. There is hardly any dropout in that segment. Versus the other group where they have not undergone reconstruction, there are people who drop out, they tire out.
Yes.
They don't feel so, enthusiastic about that, they feel depressed and all that.
Yes.
So even for, not only for the social aspect, for medical aspect also it is important that they complete their complete treatment.
Absolutely.
So that gives them the good survival advantage. And obviously the family is better because there's good feeling in the family that nothing is lost. Whatever was lost has been restored.
Right.
So that's how these people are motivated for the treatment. And with the evolution of these treatment, as Dr. Gulia said, there are multiple levels of chemotherapy. So even if a recurrence is there, it's not end of the world. So there are many levels of the treatment has become very advanced. So breast cancer is one of the best managed cancers. So we expect long-term survival. So reconstruction is all the more important because the lady will see the scar in the body every morning.
Yes.
Every day per this thing. So it's very important. If she feels good in the physique, she feels better. The family feels happy about that.
Absolutely. Very, very important. These things are not spoken about so much, but they add so much importance.
Yes.
Dr. Nadkarni, one last point. As we were talking earlier also, innovations are happening in medical fields and in this field also, like you mentioned earlier in the discussion. The way ahead, what are some, light at the end of the tunnel for people who are really worried? And one point, if you could touch upon, is life in metro cities is very different from rural areas.
Yes.
How are you seeing this kind of maybe reaching out to that part of India also? Your thoughts on that?
The newer the advance, the newer the technology that comes into the medical field, it comes at a very high cost. But fortunately, our country has a lot of generic pharma, companies, and we, I think, are one of the world's leaders when it comes to generic. And when they make a generic medication, the cost really comes down significantly. So yes, I do agree with you that in the initial parts of development of a drug and introduction of the drug in the algorithm of treatment, this drug is expensive, but about 5-7 years later, we get a lot of generic medications, and these medications are significantly lower, 75-80% lower in cost and very easily affordable to everybody. And by that time, it generally, evens out the whole thing. In the cities, in the metropolitan cities, I agree with you, the patients can afford a bit more. In the rural areas, it's a bit less. But I think it is changing. Today I go to small places to give talks and all.
Yes.
And today the kind of treatments that they give are exactly similar to the treatment that we are giving in the metropolitan cities, barring maybe a few things here and there.
Yeah.
But this didn't happen 15 years ago. So I think the whole world is changing. And we are getting a better and better general level of onco care all over the country today.
Dr. Ahmed, one more thing, one term that I've heard is called secondary reconstruction. How does that apply for patients that have suffered from breast cancer years ago and have been cured by it, but they carry the scars with them? So how can this help them?
Yeah, they can also be helped by the modern plastic and reconstructive surgery. Secondary means they are being treated secondarily after completion of cancer treatment. Primary reconstruction when we operate simultaneously with the breast surgeon. So these group of patients who could not avail that facility at the time of their mastectomy, they can also be benefited by secondary reconstruction. So we can restore the deformity and review and they can reduce the scars of the previous mastectomy surgery by doing reconstruction, and they can feel better.
Okay, fantastic. So there is, even if somebody has suffered this earlier, there is this reconstruction which they can be benefited by even now.
Even if you have missed the bus, there is still some hope for you.
Well, thank you, Dr. Nadkarni, thank you, Dr. Gulia, and thank you, Dr. Ahmed, for being a part of this discussion. Well, that was a very informative chat. While it is true that breast cancer is a serious issue in India, what's also true is that private hospitals, with their innovation and experienced army of doctors, are doing their very best to make the Indian healthcare industry combat breast cancer in India. That's all on this episode. We hope to bring you deeper insights on the Indian healthcare space again in the future. Thank you so much for watching.